Dr. Linda Trotter is here today to discuss her business and all the services that it has to offer. She's a dentist locally, and it's actually an aesthetic dentist, we should say. So you do all kinds of things. So welcome aboard and tell us some of what you do.
Thank you, Karen. I appreciate you being here and having the opportunity to discuss my dental practice. I guess the first thing that I want to say is that I absolutely love what I do. I love dentistry, and I love getting up every day and coming to work. I have a new dental practice. It's not a new dental practice, it's a new location. And I've got a great staff, and we're very family friendly, and it's a great place to be.
I know, I hear great things about it. Let's talk a little bit about what you brought in, and I don't know if we can get some pictures of this on the table, but it gives people an idea of some of what you do. We all have heard of Invisalign. Tell us what Invisalign is.
Oh, that's thanks for asking about what Invisalign is. Invisalign is an alternative to traditional orthodontics, okay? It's where we take an impression much like this. We make a mold of your teeth prior to beginning, and then a series of clear plastic trays are fabricated that you wear 2 weeks at a time. So every time you come in, you wear one tray for 2 weeks at a time, then the second tray is worn for 2 weeks, and the third tray is worn 2 weeks at a time. At the end of the 6 weeks, you come back to the office and we give you another 3 sets of aligners.
Okay, so these are basically clear braces.
They're yes, clear braces, absolutely.
And they move slowly. So you see, you know, I had braces as a youngster and they were painful. Are these as painful? I guess it always hurts when your teeth move, but at least these look better, right?
These are not as obvious.
Okay.
Most people can wear them, and people don't walk up to, especially an adult, and say, oh, you've got braces, or why are you wearing braces? Because they're pretty inconspicuous.
Good.
Also, it allows for someone such as yourself that is speaking a lot to orthodontically correct their teeth, their smile line.
Without everybody at home noticing.
Without everybody at home noticing, absolutely correct.
Then you got to worry about spinach in your teeth. Okay, just kidding. All right, now what else did you bring? Because now I understand that dentists can do, besides implants and everything else she can do Botox injections and stuff. So tell us how that works.
Thanks for asking that question too. Yes, we have the opportunity now to enhance an individual smile, both with facial fillers and with Botox.
Okay.
These are
what we have.
Yeah, this is what we have. We use a Xeomin brand of Botox in my office, and it basically is a muscle, and it inactivates the muscle so that, you know, your lips might...
You're like paralyzed.
You're like, yeah, kind of like, not totally paralyzed, but yeah, it'll allow more of the teeth to show when you're speaking, okay? Facial fillers can enhance the smile lines, the nasolabial fold lines, the marionette lines, and they just kind of plump out an individual's face and make us look a little healthier, a little more youthful.
What is in them then? Is it a gel or is it a paste? What is in there that you inject that makes us fuller, that makes us look more youthful? Because as we age, we get gravity,
right,
and we lose bone loss, and we get old and ugly, and we don't like it. So how does
some of the fillers are silicone based, but obviously Botox is a toxin, and that's what paralyzes the muscle. But the fillers are actually a combination of hyaluronic acid and other substances that just plump up your skin.
And can you believe we're running almost out of time? I told you this is going to be the fastest time in life. What would you like to tell people? Where are you located and where can they find you?
Oh, wonderful. Thanks for asking that question as well. We are in Riverside, near St. Vincent's Hospital, a block up and a half a block over, right in the middle of Oak Street.
All right, excellent. And this is Dr. Linda Trotter. Now, the one thing we want to definitely do is mention a special that we're offering right now to anybody that's at home watching Look Local. What do we get, Linda?
If you call the dental office, call my office at 389-3451, and you mention Look Local, you will receive a free take-home whitening kit after you've scheduled your exam, x-rays, and cleaning appointment.
So it's something kind of new and nice for brand new patients.
Absolutely.
To come in. It's something to get them motivated to get in there, because you really only have one set of teeth for life. If you don't take care of them, It's not good.
Yes.
You don't want false teeth, right?
That absolutely gives you an opportunity to meet me, to meet my staff, and to leave with a healthy, happy smile.
Well, we've heard great things about you. Thank you so much, Dr. Linda Trotter.
Thank you.
I appreciate it. You bet.